Oh. So anyway, I'm so happy to be able to showcase all the Broward Health hospitals. And I've been doing that through their CEOs. And today is Drew Grossmen. It's your turn, Drew. You're the CEO of Broward Health Carl Springs. So welcome to our show.
Thank you very much.
You know, Drew, it's very interesting for me, especially someone who actually lives in Palm Beach County, to know so much about Broward County and the magnificent hospitals that you have down there. It's unusual, I think, to have one. Maybe I'm wrong because I know in Palm Beach County they don't have this one, a big umbrella, and then all these hospitals that are under that umbrella. So, how did you manage to become the CEO of the Broward Health Carl Springs? I mean, what's your background?
Well, some people actually say, wow, you did this pretty quick in your career. Actually, when I got out of college, wasn't really sure what I really wanted to do, like most kids, I guess, today. And I had a health science degree from Penn State University and did the usual, let's go backpack Europe, let's go find yourself, eventually find yourself, come home. And I knew I had to do something in healthcare. That's where my passion was. I'm actually also the son of a physician, so I kind of knew where I wanted to go in my career, not to be a physician. Thought about it one time, but then saw sort of what the father went through. So I said, there's got to be another way. So I had moved down to the Washington, D.C. area with a friend of mine who was at the University of Maryland and was living in his apartment and kind of just doing some temp work, worked as a researcher for a pharmaceutical company. And then I got interested in saying, you know, there's got to be a business aspect to this. And so there's healthcare administration. So right in my backyard was the George Washington University. So went down there, talked to a few of the professors, got to look in on a class and kind of went around the George Washington University Hospital and said, I can do this. So next thing you know, I applied to various programs around the country and got into George Washington University, decided why move far away. It's right there. That's where I went. And then I had to do 1 year of an administrative residency in that program and got the opportunity and still can remember getting the phone call from North Miami Beach, Florida, where Parkway Regional, which was a Tenet healthcare facility at the time. And the CEO there was like, how would you like to come down here for an interview as possibly being our administrative resident? And at that time, I looked right out the window as it was sort of sleeting and snowing, and I said, when can I get on the first plane? So I made my way down there, interviewed. The next week, they offered it to me, and that's kind of how my career got started. So I was an administrative resident at that facility for 1 whole year and then stayed on with Tenet after that and got to also work in Los Angeles, California. So I went out there for a little over 2.5 years and worked at one of their big flagship hospitals. So there is where I really start to dive into all different areas of, you know, building up a heart program and building up orthopedics programs and how do you recruit physicians and building up those relationships, and you can just name it. It just keeps going and going. But most importantly, you know, how do you develop your relationships with your staff and the nurses and the managers or directors, and that was a big key component of that learning experience. And then got to come back still with Tenet Healthcare and actually had worked back at Parkway once again. And then kind of out of the blue, I said, you know, I got to move through the rankings here, and I got the opportunity to come to Coral Springs as the chief operating officer back in December of 2005, and where I've obviously been since then, and worked my way through that for about a little over 4 years, and then was eventually named the CEO to come on board or to take over, and I've been doing that for a little bit, close to 4 years now, and it's been a wonderful experience. I can't be more than happy with, you know, you get the support that you need. And there's just so much going on. I think healthcare is just one of those environments or landscapes that's constantly changing. So that's kind of where, you know, I got my start, where I'm at today, and there's just a host of things that it's never ending.
And people who live in Carl Springs love it. I know that when I was in real estate many, many years ago in Boca Raton, and that's where everybody wanted to live. And then there were new places that were opening up in Carl Springs, Weston. Those were the places. And Carl Springs schools have great reputation. And not so much is known about the hospital. And I thought it was very good that you were here so that we could kind of get into that. Carl Springs is very much of a family organization, isn't it? I mean, city.
Absolutely. It's a wonderful city to raise your kids, and obviously as a whole family. Even the surrounding communities such as Parkland, and you got Margate and Coconut Creek, and and Tamarack and all those areas. These are the communities that we serve, as well as people that come from far distances. And like I said, it's just a great place to have your family. And as the medical center for these communities, we're trying to build a reputation. And we do focus on, when you talk about family, we have a program that's called Patient and Family Centered Care, which is basically our customer service program, which was instrumentally developed by our guest relations manager, as well as we have a steering committee, which I sit on with some of my other fellow administrators and other people that have volunteered to be on there. And it's really just a big focus of, we round every day. We round on patients, and it's not just the nurses that round or the doctors that have to round on these patients. We have our managers and others that have stepped up to the plate, and other fellow administrators, where we are assigned anywhere from 4 or 5, maybe up to 6 rooms. And on a daily basis, we go to those rooms. And we keep rounding on the patients and ask them a series of questions that tie into the thing called HCAHPS, which is our customer service scores, which we get rated on and based on from the federal government. It is tied into some financial components there. But we really do center on, and try to teach our staff and trying to change the culture, which we've done a pretty good job over the last 4 years internally, where we're trying to really make sure that they understand what the hospital is about, what we're all about, that we are here to make sure, it's a place where people come and they're very scared. They're not sure what's going on. And we try to make sure that we put them at ease and make them feel like they're getting the best quality care and customer service possible. And it's a daily basis thing. But that's the basis of why we're here. They're our greatest assets are the patients and their family members, and that's what we have to focus on.
Yeah, that's an excellent philosophy. And of course, as the CEO, the problems as well as the joys come right through your door. And if you had a wish list and you had all the money that you could possibly spend there.
Oh, that's a great thing to say.
I love that. You can dream on, right?
Those are my wonderful dreams I have at night, yes.
They're flying over your hospital saying, oh, okay, we're going to
But you have to wake up in the morning to reality as well.
So your responsibility is the money you do have, you have to prioritize it.
Absolutely.
And make sure that it's going the best it can. And, of course, having great doctors, very, very important. And I know some of the doctors from there are really special. And you also have some other things, and I do want to focus in just for a minute or two on this marvelous woman, Lisa Boucard, and her brother, of course, Vince, who is currently the mayor. But Lisa has so much spirit, and having her the breast cancer center right there, I think is a wonderful thing.
Yeah, I think first and foremost, if anybody ever thinks they're having a bad day and things aren't going well, you sit down with Lisa, and she'll put you in your place, because here's an individual, a woman, who has not given up. Somebody who was diagnosed with cancer in their 20s. Today she's in her early 50s. She's still battling it, from a metastatic form. She never gives up. There's always a smile on her face. She's highly involved with the hospital, does a great job in working with our marketing department. And we've developed the Lisa Boucard Breast Cancer Fund as part of the hospital, and as part of with her and her brother Vince and his family as well, helping out. And in the time that we've had this fund, which has been many, many years now, it's raised hundreds and thousands of dollars, and it's providing that financial need, because there are so many women out there. As much as everyone's supposed to have health insurance today, the reality check on that is a lot of people still don't. And those women that don't, we provide that financial assistance to them. And we have done so many mammograms, and we have had diagnosed over 60 women who did not know that they had breast cancer. And out of those 60, some are still fighting the battle today or have survived. We have all of those 60 plus still with us today.
Oh, hallelujah.
So
That's great.
there's a huge mission that we've accomplished, and we're not done. And really the brain and the hearts and the spirit and the talk and the support of it is it's Lisa, and she's the one who really pushes that forward. We're just there to kind of help and put some of these events together, but man, she's the one who's out there, and she's socializing, and she's marketing it, and she's telling her story. And we've even developed the Lisa Room, which is at our Women's Wellness Center right by the hospital, and it's a really good place for women that come in who either have been diagnosed or say they're going to find out maybe if they do or don't have breast cancer when they take one of our digital mammograms. And if that place alone really tells the story and can kind of put a person at ease and say, you know what, I'm not alone in this battle, and I'm going to survive this. I'm going to battle this to the end. And Lisa's a perfect example of someone who just continues to do it today.
Yeah, right. And I just want everyone to know my guest is Drew Grossmen. He's the CEO of Broward Health Coral Springs. They're located at 3000 Coral Hills Drive in Coral Springs. Coral Springs is a very, very nice community. For those of you, I don't know if you're listening and you're thinking about moving somewhere, but I would say that Drew and I would both say, even though I don't live in Coral Springs, I know enough about it. They have a wonderful museum. They have an art center. And according to their mayor, there's going to be a lot more changes that's happening there.
A lot of changes, and a lot of people don't know it's also a great place for youth athletics. They have the largest youth soccer association in North America. Literally
Yay,
about
soccer.
Yeah, they're talking about this is a good time of the year,
Right.
even though yesterday was not a good day for one host country. But when you have 3,500 plus kids playing soccer at one time, that kind of tells a story right there. So that alone is why we're involved within the community, and we do a lot of sponsorships from all the different sports, whether it's soccer, football, baseball, lacrosse. We do it all because we want to obviously put our name out there to tell them that, again, we are your community hospital. We also have a great urgent care center that's located in Coral Springs as well, up in the Magnolia Shops. So that's obviously as part of Broward Health, and that's actually run by our administrator down in Weston, and they've done a tremendous job. That's been open for getting close to 2 years this coming September, and they provide a lot of the non-emergent urgent care type stuff. If you're sick, you're not feeling well, maybe scrapes, bruises, things that you may not want to come to the ER for. So it's another option, and it's a great option for our community.
And they're open, I think, 7 days?
They're open 7 days a week, and during the week, hopefully I got the hours right, but between 8 and 9, and then I think it's reversal on the weekend 9 to 8. So
right, it seems like right.
So at least for anywhere from about 11 hours worth in a day.
So tell me about your ER. And what is that like? Because that's always, that's the one thing that always gets in trouble.
Well, in trouble, it's any hospital across the country. That's where the majority. That's where it all happens. That's where the majority of your business, where it could be 70% of your visits or your business is coming through, as high as even 80%, and you have a lot of admits that come through there, and we'll have anywhere from 700 to maybe another 800 plus admits may come from that alone. But our ER has grown tremendously. We were fortunate and got wonderful corporate support many years ago, and we actually completed an expansion of our ER. So we went from 12,500 square feet to close to 29,000 square feet. And we went from about 17 rooms to 40 rooms. And we have it separated out beautifully now, where you have your adult side, you have your ped side. They have their own separate entrances. We have wonderful leadership with our ER medical director, the manager, and the entire staff. They do a wonderful job. The peds ER alone has been named the best peds ER by the South Florida Parenting Magazine twice. And of course, we're still trying to seek that award, but we've won other awards as well. We're noted also in our HCAP customer service scores for our peds and our overall ER. And literally in 1 year, and our fiscal year goes from July 1st through June 30th, so we just finished one fiscal year and we've just started a new one. But just from the one we completed to the one we had before, we went from 58,500 visits to 64,000 visits in 1 year.
That's absolutely mind-blowing.
That is very mind-blowing. That is huge, and that that's 24/7, 365. That place has taken on a lot of people, but they do it with great stride, great patience. They provide the great quality care and the customer service, and has been reflecting in their scores. And I think, again, we were thankful that we expanded that out. And probably one of the big stories that we have in there is we always have a statistic that we look at, which is called left without being treated. Those are the people obviously that walk in.
Wait. What do you call it? Left without being treated?
Left without being treated. It's called LWT. It's a term. Sometimes they say left without being seen. But these are individuals or families or whoever comes into ER, and they feel like after a while they're not being seen right away, and they'll take off, or they're not getting the care that they seek. Well, we make sure that we get that percentage down very low, and some hospitals will get up as high as 5, 6, 7%. We are actually less than 1%. We get our people in to see at least somebody in the triage, usually a mid-level provider like a nurse practitioner or a physician assistant, and eventually, then they get pretty quickly back into one of the beds that it's needed to be seen by a physician. Yeah. So.
I never heard that term before, but in the business, that's.
Well, we're really, really big on patient flow at our hospital. That's something that we have to improve, just because of the size that we are and the growth that's happening around us. Our communities are growing huge. I mean, just look in the city of Parkland alone, we're expecting another 15,000 to 18,000 people moving into that city. There's already 2 developments that are underway, and some parts are already done, and people moving into those new homes. And some of those people, whether moving within the city to those areas, and will get backfilled their homes by other people moving in the community. And there's pockets in the city of Coral Springs that are looking to grow as well. So we have a lot of population that's going to be coming into our area. We're doing a lot of analysis on it, and we've been given the green light to look at expanding the hospital.
That was my next question.
Yeah, well,
it sounds like you're going to have to do that. And now, if you expand it, would it be in a particular area of specialty or just general?
Well, it would be a shifting of some business, and we'd look at it maybe growing some other service lines as well. What our plans are entailing today is to build, we could go another 4 floors on top of the hospital, but you have to make sure it's efficient and effective, and it's making financial sense in all this. So when we looked at all the different plans and working with the architects and some of our consultants, it boiled down to we need to build another 3-story tower. It's a 4-story building, but we looked at 3 stories, and it would be on the south side of the hospital, which is where the main entrance is. So that's, if you're looking at a bird's eye view, we've got a west, a north, and an east wing. We'd have no south side. So as part of that south side 3-story building, we'd get a brand new lobby out of that as well, but we get a whole brand new labor delivery area, and then stacked on top of that in the second floor, you would have a second floor mother-baby, all private 28 beds. We are currently part semi-private and part private, and we've got to have a more competitive environment. So that's what we're trying to create right now. And then on top of that, what we've noticed from some of our analysis is we need some more medical surgical beds, and we're going to go for another 28 private of those. We'll end up hopefully backfilling the current mother-baby unit, which is our postpartum, which I said would move over to that second floor with some more medical surgical beds. Then we got to kind of look at, got to do this right. Hospitals are changing. Like I said before, the landscape of healthcare is changing. A lot of the outpatient business is going out of these hospitals across the country, and we're no different. So we're now trying to look at different service lines. So we need to build maybe possibly outpatient centers that look at diagnostic imaging testing, maybe a surgical center, because you're always working side by side with the managed care companies, and they will direct the way the business goes. And they'll say to their patients, you need to actually go to this center. The doctor is tied in. He may have a vested interest, or he belongs, or this is where he likes to go, because obviously they're looking at their cost controls as well. So like I said, things are changing. We're trying to change in that direction. I think we can definitely get there. We're a very good system. We're the 3rd largest public health trust system in the nation. So we've got a lot to offer our communities out there, whether our hospitals are on the east side or us being out west, just like the Weston Regional Health Park also, which is down in Weston.
So tell me, when you get a call in the middle of the night, what kind of a call would it be? Other than a fire or some explosion? I mean, what else?
Oh, I don't want those calls.
No, we don't want calls.
I know. We've had the calls where, hey, we got a floor that's flooding. We've had those. I've had unfortunate experiences where there's been some violence as well. But I think for the most part, a lot of the times the calls that I get, whether it's 2, 3 in the morning, and I don't get upset at that when my nurse supervisors are calling me, because that's the job I took. It's part of my job. It's what I have to deal with and what I have to do. And most of the calls is usually transfers. There's a doctor who needs to transfer the patient to one of our sister facilities, or it could be outside of the system, and they could be having trouble maybe with another doctor on the other side who won't take the patient. And sometimes you have to look at, sometimes if it goes above and beyond, and it's another type of level of care that the patient needs to go to, and we can't offer it, we've got to get the patient to that hospital. And that's our responsibilities for all hospitals across the country, is making sure we all are trying to work together, whether you're for-profit, you're not for-profit, you're this type of community or that. You got to think at the end of the day, it's for the patient and the family that goes along.
I think your father would be really proud if he is he around today.
Oh, he's still alive. Yes.
Is he here?
Yeah, no, he lives outside of Atlanta, Georgia.
Oh, that's a nice
he's
place.
Been retired for about 15 years now and loving, I think, every second of it.
Oh, I'm sure he does, but I'm sure he's thrilled with what you're doing too, because he understands. He, as a physician, had a much smaller responsibility. He had his patients, but just think what you have.
Yeah, but it's kind of identical. The community that he practiced in Pennsylvania was kind of very similar to where we are at in Coral Springs today. It's sort of that community, family-oriented based, and everybody knows everybody. Everyone knows who the doctors and the political players are out there and so forth. So it's a very similar setting. So it's kind of nice.
Yeah, well, we don't want you to have to be involved in politics. I just hate when healthcare and politics get together.
I try to stay out of that as much as possible, but you also have to follow sometimes the directions that are given to you as well. So.
And one thing I know from being in the board meetings or the Broward Health is there's a new wall of donors. I love that idea.
Yes.
I hope you like it.
Yeah,
it's very exciting.
It's called the President's Council. These are people that are donating, and a lot of it comes through personal donations anytime during the year, as well as people that as part of our employee giving campaign, which we do every year, and that's gone on since 2010. And as a matter of fact, now that we've completed the 2014, the system-wide has raised about literally $1 million already. So every year, each region has their own goal. Ours this year was $22,000. We actually exceeded that by over $30,000, and that's basically employees giving, whether it's their personal leave time, actual checks, and actual money. We do all sorts of fundraising, within our guidelines, and I think it's been a huge success. And that money comes back to us, so we invest that back into our facilities, whether we're upgrading some of our aesthetics in our different areas, or if it's equipment that we need, or it could be as simple as we need more tables out on the patio off the cafeteria. It can be as simple as that.
But it's unique to go to your very employees, and I heard about this in one of the meetings, to ask them now to contribute to the place where they work, which I think is extraordinary, because then it's ownership, isn't it?
Absolutely. And then there's some that will contribute to the other Broward Health facilities. They can check it off on the form that they get. So, and I'm sure there are some that contribute to other facilities. We have a lot of employees that have worked at, some of them may have worked at every single facility, and some may have worked at 1 or 2 or 3. So we've got people who have internally transferred. So, they have their love and their passion, maybe from where they started as well as where they're at today.
But it sounds like Carl Springs, really, your hospital is very geared to the families, the children, the babies. That's what you're pushing now, because you're going to have a lot, compared to something that like Broward North, which is, I think, more for an older population.
We're really focused on our labor delivery, the mother babies, our neonatal level 2 NICU, which is a wonderful area. Unfortunately, if your child has to go there, but we have wonderful neonatologists that provide great care to those children and the families, and a lot of success stories there. Our pediatrics, we're growing that hopefully by leaps and bounds soon. We're looking at more recruitment of physicians. We're looking at changing some of the aesthetics there as well, with some of the money that we brought in either from the employee giving or from the Broward Health Gala as well. And looking at artwork, and we've got a wonderful manager there as well. We also have created a concussion program. That's another program that's one of the first in our area.
Now that's really for the sports. I think concussion
that's
very
exactly
important, right?
Exactly where I'm going, because with the youth athletics, as I was mentioning, between all the cities around us as well as in the city of Coral Springs, a lot of these programs, and you hear it through the NFL all the time, all these brain injuries, is I think you're going to see a lot more youth athletics being basically saying that you have to have a pre-concussion test before you start any athletic. And that could be coming in a few years, because you see this, starting to get some more traction out there. So what we provide is an actual pre-baseline concussion program at Broward Health Coral Springs. We also tie that in with our sports, or our back-to-school or sports physical packages that you can do at the Urgent Care Center in Magnolia, or as well as our hospital. And we also we're forming an agreement in our association or partnership with Nova Southeastern as well, because they do the post. So in other words, if your child has the pre-concussion testing or baseline, and unfortunately they have a brain or some kind of head injury in a sporting event, or it doesn't even have to be a sporting event, it could even be you're in a car accident or something else, we have the information on them already, and then they can go down to Nova Southeastern and get the post-concussion with our agreement and our association with the physicians down there.
So it sounds to me like you have, when we talked about a wish list, you have a whole plan here. And you're seeing this plan, but it looks like a lot of the things you wanted are coming true, and it all has spider veins that are going.
It's in all different directions, but it doesn't form or develop or get there with the successes if you don't include, it's the management and the staff that have jumped on board and have been part of that. Between our concussion program, our primary stroke program, which we just got recertified by the Joint Commission, we've also gained not just the bronze and the silver, but we also got the Gold Plus Award from the American Heart Association, which has this program called Get With the Guidelines, which looks at your quality, your outcome measures, and we've been very successful with primary stroke program. We also just got Joint Commission certified by the Joint Commission for our colorectal center program, our minimally invasive surgical program, which we are now the only one in the state of Florida.
What is that? Now tell me what that is.
Well, it's an accreditation basically for minimally invasive surgery, where it's, instead of doing the big cutting open,
interventional radiology.
No, it's interventional colorectal surgery.
Oh, I'm sorry.
By two of our
interventional colorectal surgery.
Right.
That's pretty serious.
Right, done by two incredible surgeons, as well as our manager, who was really behind this whole program, as well as a lot of the other staff. We have a certified wound ostomy continence nurse who's also part of it. It's a multi-specialty approach to this whole program.
You may want to get one of those doctors on my radio show, because it sounds pretty interesting.
You probably would.
I'll let you handle that for me.
I could do that for you. They're both wonderful, and they both are extremely well known in the community. And like I said, we're the first to have this accreditation by the Joint Commission in Florida, but we're the second nationwide. There is another hospital in the South, in another state, but again, we are the first in Florida. So we're very proud of that as well.
You sound like you have a lot of firsts, and you're very enthusiastic about all this. I don't think they could pry you loose from there, so nobody else can call you and say, come on here, because you have a lot of work to do. You have a great goal.
Well, like I said, we do everything from whether it's pediatric care, all our women's wellness services. We've got a lot of men's health services. We've got great robotics program with our urology, as well as our GYN services there. Like we were talking about Lisa Bacard, we've got the big women's wellness run we do every year, which now coincides with the City of Coral Springs and their half marathon. So it's a great event. Actually, the 10th one will be coming up in March of 2015.
Well, I have to give everyone your phone number. If they do want more information, they would go to 954-344-3000. That's 954-344-3000. Or you can go to browardhealth.org and look up Coral Springs. And Drew Grossmen, you've just done a great job, and we're so happy that you came in this rain to do this interview. But you have so much to say, and we certainly appreciate you being here.
I thank you for the time. I appreciate it. It's great.
It was great. We really appreciate it also.
And I'll get you that doctor.
Yeah, get me the doctor. Thank you very much. Bye.
You're welcome.